My family and I have already given up so much to pain, and it is only my faith that enables me to push forward through these obstacles as the pain I experience continues to worsen. But today, after the IOM event and the release of this paper, there is reason for hope. Hope for a better future for myself and my family, as well as the millions of families across our nation who bravely battle this life-altering issue every day of their lives.
Endometriosis caused me severe pain for weeks of each month. It also meant that I was never able to experience the joy of giving birth and having children. I did eventually have a wonderful daughter that my husband and I adopted. In subsequent years, after being misdiagnosed multiple times, I was correctly diagnosed with fibromyalgia. At the height of my pain, I couldn't go to work and I couldn't get out of bed. Imagine a vice grip on your muscles. I also developed TMJ and irritable bowel syndrome. TMJ is like having rocks in your jaw, and IBS is like having your colon on a perpetual roller coaster.
I couldn't move my head like more than a hair without it killing. And, you know, I got dissed by my beautiful female doctor who asked me if anything emotional was going on. I mean, it was just a horrendous experience. Physical therapy and a lot of exercise and a really sweetheart doctor at New England Baptist Hospital who understood, who got it, who believed me, really helped.
Nurse anesthetists know firsthand the experiences of their patients having pain. And if there's one thing I'd like to communicate, it is that chronic pain is not everyday pain. And I think we've heard from the stories here today that it really is that compounding, irascible pain that haunts individuals and leads them to tremendous personal and economic despair because they are living with it every day.
There is so much work to be done. It is the amount of research dollars that are attributed to this problem is so extraordinarily disproportionate to the magnitude of the problem. The amount of education professionally that all of us, no matter what our sphere of expertise and discipline is so does not begin to live up to the needs and the expectations that we as professionals in any sphere have to meet these challenges. So we've got a lot of work to do, and that work is ours. The IOM committee is not there to do that work. They can't do that. They've exposed, if you will, and I'll speak in medical terms now because these are really colorful words. They've exposed the abscess. It's now ours to drain.
There's much more that can be done when there's a unified voice, and today we're happy to do that. We're optimistic about what's in the report, and that it will certainly convey the struggles to our policymakers and to the general public to serve as a beacon for the removal of the barriers, absolutely preventing effective pain care, and really quantify the seriousness of pain and its undertreatment, and provide recommendations that will serve as the foundation for improving pain care, research, and the education and the treatment for all. So again, my thanks to all of you for what you do, and I hope that you go home as happy as I am today and inspired by this morning's announcement and the summary of the work that's been done. Thanks very much.